everybody, my name is Alise. I am a student physical therapist assistant at Jefferson State Community College, and today I'm presenting you a rotator cuff repair treatment plan. Our patient is a 28-year-old male who complained of right shoulder pain for 3 months, and then now he is 6 days status post a rotator cuff repair. When working with this patient, there's 4 things you want to assess each treatment. 2 objective findings that you can assess are shoulder range of motion, whether it be like flexion, abduction, external rotation, but in the initial phase, it's going to be more passive because you don't want to apply stress to the healing rotator cuff. Another one you could do is tenderness to palpation. If you touch it and it's sore, especially around the incision or the muscle bellies. By assessing these 2 things, you can tell if some of the interventions through your therapy are helping or how you need to modify your treatment. Some subjective information that you need to assess is our patient complains a lot of having anterior shoulder pain while he's sleeping. Just continue to ask about that. Or if he's still having trouble while he's laying on his sides. And another thing you can ask is their pain level for the day. But you can do that objectively by using the numeric pain rating scale, which is the NPRS. And you can ask, Mr. Parker, how would you rate your pain today out of 0 to 10?
6.
6? Okay. Like I said, you want to check these every day to make sure that the treatment is working like it should. This patient, he is, like I said, right shoulder repair. So he is tender, he is painful, and he has a limited grade 3 and 4 inferior glide, which is if you do shoulder abduction, which you're taking it out to your side like this, it's going to where the humeral head will slide inferior angle. Okay? What you're going to do is a grade 1 or 2, which is a lighter form of the inferior glide. It doesn't provide as much of a stretch, but it does allow for mechanoreceptors to be released into the joint capsule to where pain can be blocked and help relieve some of the pain. You have some problems with grades 3 and 4. We're just going to do 1 and 2. And what you do is you just stretch. And you're going to push your force with your hand closest to his body and go inferiorly towards his feet. So what you want to do is and it's going to be just a very light force, okay? Because we don't want to go to the end range of the joint capsule. We just want to allow some movement in the joint for the mechanoreceptors to be released. Does that feel okay, Mr. Parker? Okay. How would you rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the worst right now?
6.
Still a 6? Still also getting movement into the joint capsule so that when he does go to do range of motion exercises, he still has some movement and it's not as stiff. Like I said, our patient has anterior shoulder pain or symptoms when he is sleeping. So, can you look at him? What we're going to do is try to teach him how to sleep with his arm in a comfortable position. Now like this, you can kind of see how his arm is going down at an angle. So on his right side, what we're going to do, and you can use different size pillows, just depending on what they have at home, as to where you can have their humerus in line with their scapular plane, okay? So, does that feel comfortable? Does that feel a lot better than it would if you were laying down without the pillow?
Yes.
Okay, so you just want to get that into a straight plane right here. And you can even double it up if you need to, like this. This will kind of help to relieve some of the pain that he's having at night and kind of help to reduce the amount of disturbances he has. So Mr. Parker, what we're going to do now is a home exercise that you can do at home. If you would like to stand up and watch me perform it first and ask any questions that you might have. So during this exercise, the patient's going to be lying down. He can do this on the floor, his bed, just pretty much something that's sturdy and supportive. And what he's going to do is he's going to take his left hand, or the strong hand, and grasp his right arm to where the right thumb is on the top of the interlocking grip, okay? And while he has his right arm relaxed, he's going to use his left arm to help lift to where the right arm can have a flexion motion. And you just want to keep your arm relaxed during this motion because we don't want any active movements putting stress onto your healing muscles, okay? You want to hold this for about 10 seconds and slowly return back to a starting position. And when you go back into this position right here, you don't want to go so far back to where it hurts. We just want to keep the range of motion, okay, so it doesn't get stiff and stuck into a position. That will help to keep the range of motion, like I said, help stretch some of the muscles, just make sure there's no pain. If there's pain, discontinue the treatment and talk to your therapist about some way of modifying the exercise, okay? Lying down on your back and you take your arms up. I want you to take a deep breath in and relax. And as you're holding it for that 10 seconds, I want you to keep a steady breathing rate, just normal in and out. And then as you come down, exhale to return to a relaxing position. Okay, any questions? 3 sets of 10, holding each one 10 seconds to get a good stretch. And do this about 3 times a week. Every other day will be great, just so he can give his muscles time to relax. Patient's rehab potential looks really good. He will eventually be able to return to work. The amount of time for the recovery is patient dependent depending on the size of the tear, the doctor who did the surgery, the procedure that was performed, and the lifestyle of the patient. So if he's very active and he does his exercises that he's told to do at home, then he has a pretty good time frame for return to work. And he will return to normal function. All right, thank you, and you'll have a good day.